Good evening, everyone, and welcome M&A D5 members and all of our guests from across Maryland and the District of Columbia to a wonderful program that we have put together to help support your well-being as a nurse. I am Lou Bartolo, your president of District 5 M&A. Being a member of M&A has offered me to be a board member and the president-elect over my years involved with M&A. District 5 has allowed me to connect with other nurses, been able to advocate for the nurses, the profession, health access, and health equity with Maryland's General Assembly and Prince George's County Council. While we all know the value of our roles, whether it be direct care, education, advocacy, policy, or any other area that we choose to innovate in, the purpose of this series is to have further discussion about nurse well-being. The first nurse well-being session of this series featured the distinguished professor, Dr. Cinda Hilton Rushton from the Johns Hopkins University School of Nursing, who discussed the issue of emotional and moral distress many nurses are all experiencing during this pandemic. Tonight is part 2 and is titled Map Your Path. This webinar will focus on exploring career trajectories and opportunities where experienced and knowledgeable nurses may use their knowledge, skills, and talents while they remain active in the nursing workforce. We would like to thank all of you for choosing to be here tonight. We will also be inserting our website link into the chat for you to click on in order to join our membership. You can view resources we have, and we'll be adding all of the nurse well-being video recordings. Please remember again to mute your lines and post any questions in the chat as they will be answered after speaking with the panelists. We also have 4 gift cards for Starbucks as door prizes that will be given away, so you might be the winner of one of them. Please welcome our moderator for the evening, Dr. Melanie Bell, Vice President of the Maryland Nurses Association. Dr. Melanie Bell is a published professional registered nurse of 21 years. She's a graduate of the University of the District of Columbia and Chamberlain College of Nursing, earning her terminal degree, Doctor of Nursing Practice in Healthcare Systems Leadership in 2017. Dr. Bell's career includes private healthcare organizations, federal contractor and civilian positions with the Department of Army, and is a current federal employee. As a nurse consultant with HRSA, she oversees awardees receiving federal grants that directly impact FQHCs. In addition to her primary role, she remains on the front line of healthcare delivery as an inpatient nurse case manager. She's a visiting nursing professor, a mentor, and active on several advisory boards focused on healthcare, academia, and scholarship. As an active member of the M&A, she is the current vice president, chair of the membership committee, and the immediate past chair for the legislative committee. Please, everyone, welcome our moderator, Dr. Melanie Bell.
Thank you, Lou. Thank you very much, and good evening, everyone, again. Welcome to our distinguished guests, M&A members, and external participants. It's an honor to moderate this auspicious occasion. At this time, we'd like to pay homage to our fallen nurses lost during the COVID-19 pandemic by having a moment of silence. Thank you. Our panelists tonight are Dr. Tracey Murray, Dean and Professor at Coppin State University, Rear Admiral Aisha Mix, Chief Nursing Officer and Assistant Surgeon General of the United States Public Health Service, Linda Talley, Senior Vice President and Chief Nursing Officer, Children's National Hospital, and M&A's own Dr. Peg Daw, Director and Administrator, NSPII at Maryland Higher Education Commission. I look forward to the valuable information shared by our Admiral nurse leaders and hope that you too take away additional pearls of wisdom. If you have any questions, you may place them in the chat and we will address them during the Q&A session following the panel discussion. Also, there will be a poll. Please be so kind to answer the questions to the best of your ability. We are ready to begin. Okay, ladies. So based on your experiences, please discuss what you see as key challenges that nurses are experiencing at this time. We'll start with Rear Admiral Mix.
Good evening. Just such an honor to be here with everyone tonight. So as Chief Nurse for the United States Public Health Service, I have leadership of over approximately 1,300 active duty nurses. So when I think about key challenges that the PHS nurse officers are facing right now, a couple of things, mainly the ability to prioritize self-care, meaning how do I make sure that I can take care of myself at the same time that I'm trying to take care of others. We also have, the issues that come up when your values and your beliefs are different from those that are held in communities that you might respond to. As responders, the other piece has to do with, everyone is always focused, on the communities. We have to remember that there are people who are responding to communities, and we've got to make sure that we're addressing the needs of the nurses who are responders at the same time. So I think it really is this conflict that everyone is seeing, not just PHS nurses, but across the board. And really, how do I take care of myself in the process of taking care of other people?
Thank you. Next, we'll have Dr. Tracey Murray.
Good evening to everybody, and thank you so much for the invite. As the Dean of the College of Health Profession at Coppin State University, I want to say some of the unique challenges that I'm seeing are very much what was also said previously, but that sense of self, trying to find out, we're so engulfed many times in taking care of our patients and our family members and those individuals before us, that we're also trying to find our sense of self, that part that relates to like our own personal wellness. We start to recognize that it's very important. And we've recognized we haven't been able to fully grieving for family members and other people that we've actually lost because we've had to also go right back into work. Other things is some level of trust of our employers to make sure that we have a safe work environment and hoping that they're keeping it safe and wondering why they cannot think of alternate ways of work for opportunities wherein there are those possibilities. And that's what I see as some of the major areas. And I think there's a level of frustration for some nurses wherein they feel that we're supposed to educate our clients, especially in such things as vaccines and other areas, and then not understanding how to close that gap to make them understand how critically important getting a vaccine is so that they can stay out of being hospitalized.
Thank you, Dr. Murray. Ms. Talley.
There we go. Thank you so much for having me this evening. It's a real pleasure to be with this team and with this group, just to really put the necessary focus that we need to bring again on self-care, as my colleagues have already mentioned, and nurse wellness. When I thought about this question, a couple of things come to mind in terms of challenges. And one very real and present challenge in the daily life of our nurses is this issue of the great resignation and the turnover, and watching as their colleagues struggle with personal and professional decisions, leaving fewer and fewer of our nurses on the front line to respond to this pandemic. I think that's been very hard for the nurses who have remained on the front line to watch this exit or exodus of nurses who are looking for other opportunities. I also think about changing milieu of patients, the increasing acuity and the associated violence and aggression that sometimes comes with the change in acuity that we're managing on the front line. This is one thing that does keep me up at night. I think about, our nurses sometimes in harm's way as they, commit to the difficult work of healing our nation, healing our community. And finally, as I was reflecting on this question, I thought about the work that we've prioritized as a nation, that we're very focused on here at Children's National, and those are the issues around diversity and equity and inclusion. And I think about the work ahead as we, continue to think about our workforce in terms of the work and the people that we serve. I think it's been a longstanding issue for us, and I hope now that we have brought the right level of attention for our nurses so that we can begin to think about how we diversify, think about our workforce, how we show up every day, not only in terms of some of the racial diversity that we need to really strive to achieve, but I also think about men, more men needed in the field of nursing. To think about senior nurses and newer or younger nurses. And these are all challenges I think that we have for our workforce. And I also like to, think about the glass half full and think this is our time, this is the opportunity. We have the attention that we need, that we've needed to bring to this topic for a long time. And I think there's great opportunity that will come from the challenges that we are dealing with on the front line.
Thank you. I'm glad that you mentioned that about male nurses, because that's one of my focuses during this vice presidency is to focus more on the male nurses, because I think that they need the recognition as well. Dr. Daw, would you like to respond to this question?
Thank you. I'm so glad to be here with you tonight. I work for the Maryland Higher Education Commission, and they are the administrators of the funding through the Health Services Cost Review Commission. Maryland's unique in the nation, the way our healthcare has the commission set up. Anyway, the nurse support program has been going since 1986, and this branch, the NSP2, started in 2005. And when I thought about the question about key challenges that I see, well, our whole focus is about the nursing shortage. And we're looking at vacancy rates that have shot up from 8% over the last years before COVID to 18%. That's the negative. The positive is that Maryland was in a better position because of the funding that we received through the Health Services Cost Review Commission, and the hospitals have invested. So our vacancy rate is less than the national average. And I'm just echoing what the previous speaker said. I almost felt like she and I had the same responses. So the next thing is working conditions. Patient staffing ratios bubbles up to the top when we talk with people. And then the last thing that I want to bring to you is that we have a great team in Maryland. We got the Board of Nursing, the Maryland Nursing Workforce Center. We've got the NSP 1 and 2 programs, their advisory board. We've got the M&A. We've got so many resources. And when we put our heads together, we come up with great solutions. But the challenge is when people outside nursing come up with the solutions for nursing issues. That's the challenge, my third challenge that I wanted to share with you tonight.
Thank you very much. Yes, workforce shortage is surely a focus of everyone these days. And the Maryland Nurses Association, I want you all to know, is working on the workforce shortage. Our immediate past president, Dr. Charlotte Wood, has a group that works on workforce shortage issues and communicating with our legislators. So we are listening, we are advocating for you all. Please don't worry, we're going to do what we can to make sure that this situation is corrected. Our next question is, what is the first step a nurse can take if they are interested in pursuing advancement or professional change? I'll start with Dr. Murray.
Thank you. So one of the things you can always do is to assess and do an assessment. And so I also like to encourage people to do look 5 years forward. What do you see yourself doing 5 years from now? And then think about deconstructing that. If you think about what you want to do 5 years in advance, deconstruct that and then look at what skills you already have, what transferable skills you already have, and then think about what skills you need to build upon. And the pathway to get there is based on your critical assessment of yourself and your ability to possibly have other people who can assess your skill set and figure out what you do possess and what you don't possess so that you can get there to that 5-year plan. And the most honest opinion and reflection of ourselves can honestly get us to that next level.
Thank you very much. Rear Admiral Mix.
I think this is another one of those situations where I'm saying Dr. Murray is using my notes. I think, as nurses in general, we're always going to begin a conversation with an assessment of what is in order to determine where we're going. And I think that's the same answer that I have, related to this question. stopping to ask yourself why, right? Why do you want to advance? Why do you want a professional change? As Dr. Murray said, what is it that you hope to accomplish, right? What is the goal that you're actually trying to reach? At that point, it really does take, knowing who's doing what it is you want to do. Take the time to actually learn more about it, understand what they do on a day-to-day basis, because sometimes once you actually walk a day in the life of that person in that role, you find that actually it's not what I thought it was, and it may not be ultimately what's best for you. So I think it is that exact assessment. It's also identification of a goal, and then it's also finding someone who's doing it so that you can actually learn more. I think the only thing that I'll add is sometimes we don't know what that position is called, and that's okay too. Because at that point, what you have to do is take stock of what's important and what you're actually interested in doing, and then start talking to people. And someone somewhere is going to say, oh, that's right, that's right. Because really, within our profession, there are almost unlimited opportunities to utilize our nursing training, education, and skill sets. So the possibilities are endless.
Thank you. And I don't know if you all noticed, but both speakers mentioned the word assess, right? And that's the first thing that we learn how to do as nurses, and it can be applied across the continuum of healthcare and our work environments. And also, I like what Rear Admiral Mick said, remember your why. We should remember our why. Why did we enter this space of nursing, and keep that at the forefront of our practice? Ms. Talley, would you like to go next?
Absolutely, such great advice. I see a theme emerging, and I really want to underscore the value of relationships. Both of my colleagues have mentioned, find someone. And here at Children's, we talk a lot about the value of mentor and mentee relationships as a structure that can help to kind of formulate a relationship that is singularly focused, frankly, on having a safe place where you can explore, where you can talk openly, where you can debrief, where you can work through conflict, and where you can begin to imagine, what the future might look like, and you can learn from others who have walked before us. I just think that investment of time will deliver tenfold. The relationship again, and the sounding board that we all need, frankly. But having someone who is involved in the same work is really, really important. I think, we have friends outside of work, we have family that we can talk to, but the value of having a trusted colleague who's walking in your shoes and can understand, I think, is a great investment of time. I also think about really making connections through professional organizations and networking among our profession with other individuals, if for no other reason than to expose ourselves to a different reality, a different perspective. But along the way, I think a lot of doors open as a result, again, of that investment of time. And it allows us to begin to, kind of dream and imagine where the other possibilities are in terms of professional growth and personal growth too. I want to underscore, even if it doesn't land you necessarily where you thought that you'd be professionally, I think so many good things come again as a result of that kind of mentoring relationship that we all need in our lives.
Thank you. Dr. Dahl.
Thank you. I can only say bravo to my colleagues, and that 2 colleagues helped me to determine my next steps in the master's program and the doctoral program. And their experiences influenced me because they were willing to share the good and the bad, the up and the down. I also wanted to share that we have focused on having programs to help people look at their next steps through the nurse support program too. We have basically www.nursesupport.org, which we have all kinds of resources that are available to nurses here in Maryland, and includes all the nursing programs and all their different specialties and links and contacts. Also, we have the www.leadnursingforward.org, which is a career portal for educators, and it also talks about what it is to be a nurse, what it is to be a faculty, what it is to be, an advanced practice nurse. It just gives people information when they're searching and trying to decide what's their next step. So thank you.
Thank you, Dr. Dahl. And if you don't mind putting those links in the chat so that members of the audience could take a look at those. mentoring and networking, those are my highlights. Those are my favorite things to do for all of those that know me. And it's certainly important. And becoming a member of Maryland Nurses Association offers those additional resources. Like Ms. Talley said, becoming a member of professional organizations. So we will welcome you if you would join us. And because I'm chair of the membership committee, I would love to have you all with us. The link will be placed in the chat as well. Okay. In your opinion, does professional advancement to a leadership role require an advanced degree? I'll start with Dr. Daw.
Oh, thank you.
You're welcome.
Well, I thought about this and I thought about leadership. My doctoral degree is executive DMP in leadership, and my master's was in leadership and community-based health systems. So leadership has been my mantra. I've been a leader in a nonprofit organization, volunteer. So I thought about it and I thought, what did the research say? So the research says that leadership is 30% inborn, it's part of your nature, and then 70% learned. So we can all learn to be leaders. But some of us are just naturals. So some of the natural things that you have are communication, integrity, and accountability. So an advanced degree, I'm going to say you can be a leader wherever you are, because we have bachelor prepared nurse managers. We have people who step up and take on responsibilities as a leader. You gather more skills and gain more of an in-depth understanding when you advance your degree. So that's my perspective.
Thank you. And I know with your organization, you have certain maybe scholarships for nurses and so if you could put that information in the chat too, for those that are looking to advance their degree, that would be great. Thank you. Ms. Talley?
Well, I share Dr. Daw's opinion very strongly. I believe that knowledge is power. I think we're all on a journey throughout life of evolution and change, and part of what informs that is seeking out the knowledge to support that evolution of thought. I think I also think, we're role models, and we have to remember that we're setting, a standard, that there's precedent in terms of how we acquire those skills, that others will seek to role model, that they'll take kind of their cue, if you will, from the value that we place on higher education. I know that there are a lot of critics and there are increasing number of skeptics around the value associated with advanced degrees. But I believe, given the challenges, given the constant expectation of us to be at the top of our game, to be able to demonstrate expertise in continuing education in terms of how we take care of increasingly complex patients and families. I believe that education is just core. Knowledge is power. And as leaders, I think just having gone through the rigors of a formal kind of curriculum prepares us uniquely for the challenges and the rigors of leadership.
Thank you, Ms. Talley. And Rear Admiral Mix?
Yeah, I also agree that nurses really can be leaders in any role. But in looking at this question and professional advancement to a leadership role, if we're talking about formal leadership role, supervisory, management, executive, then yes, it is my opinion that as nurses, we need to seek advanced degrees. The reason that I say that is that leadership involves the coordination of people, and it also requires an ability to think at a systems level, right? So at that point, you're really pulling together different pieces. And I see it as the difference between practicing nursing, right, versus practicing and applying nursing, right? So there's this ability for you to then translate what you know and what you can do and be able to communicate that to others that are working within a larger system so that you can help meet organizational goals, right? And so I think at that point, you are building upon, an advanced degree that not only advances your nursing educational foundation and skill set, but it also brings in other competencies such as strategic planning, right? Financial management, entrepreneurship, being politically and professionally savvy. That's not something that many of us received in our pre-licensure BSN, ADN, however you came into the nursing profession at your first license. So once you get out and you're now engaging with other professionals, and you have to have a dialogue and you have to create this voice as a nurse, some of that has to be taught, right? There's some nuances that I can tell you, each of my colleagues on the panel can tell you that first time they were thrown into that experience where you actually had to be the nurse and the only nurse and had to be able to communicate from a nursing perspective. Those skills are important to not only learn, but to hone. So I do think that there is a role for advanced education for nurses.
Thank you. I can recall getting my associate degree and I waited 10 years to go back to school, but I knew that I didn't want to be limited professionally with growth in the profession. So it was my duty to myself to go back to school. And now I encourage others to go back to school. And if you're looking for a mentor and you're doing your doctoral program or your master's program, and if you join M&A, there again lies another opportunity for you. So thank you, Rear Admiral Mix, who has her doctorate in nursing. And next, I'll have Dr. Murray.
Thank you so much. I'm going to say yes, that it definitely requires advanced education. And of course, being a mother of 5, I have to say, yes, go back to get higher education, because my children cannot finish with just a high school diploma. But more importantly, clearly we know in nursing, and if I'm gonna look at from higher education standpoint, the advancement for that area does require more education past a bachelor's degree. You want to have those advanced skills, information that was talked about, the systems theory component, but you learn how to learn, and you have to see the organizational component yourself as a leader and be able to look at the big picture. Beyond that though, your master's degree, when I lived in Florida, I'm a Floridian, so I'm from Florida. Being a master's, having a master's degree was like, probably it was like amazing in some areas of Florida. But when you come to an area like this mid-Atlantic area where people are super educated, it is not going to actually be enough. Having a doctorate degree is a requirement. Many universities within the state of Maryland have doctoral degrees that they offer, doctoral nursing practice, and also PhDs. But with those particular DNP, I happen to be family nurse practitioner. So that is considered was a terminal clinical degree or terminal degree for that particular profession. But I myself, when I went to school, I wanted to do a dual degree, a DNP and a PhD. And at the time, those programs did not exist, because I also realized that understanding like research and research components are very important. And I went on to get my PhD for myself. It wasn't required for my position. So it shows you there's a level wherein wherever you work will decide necessarily what is required. But more importantly, you yourself have to know what you want for yourself and how deep you want to go in your own education. Everything can't be learned in higher education. There are some skills that you will learn along the way. My husband had a business, so I learned a lot of my finance components, the strategic planning, some other pieces by being his chief operational officer. And I believe wholeheartedly by being a mom, I have learned a lot of other skills that you can use, just we all use. So when, from smaller financial management, planning, logistics, many other things. But transferable skills are everywhere. Some people learn in the church, some people learn at their nonprofits, but there's so many ways you can look at it. And it's the holistic part of you that you bring forward to the experience that makes it worthwhile.
Thank you. And so I think we can all agree on leading from where you are and advancing your career. Joining organizations will help to bring on those leadership positions, like within District 5 or within the M&A. Thank you, ladies. As a reminder, if you have any questions, please place them in the chat and they'll be answered during the Q&A session. You'll also receive a poll. Please be so kind to answer those questions as well. Okay, moving on to the next question. In your organization, does advancement into leadership positions require an advanced degree? Did we do that one? No. Okay, Ms. Talley.
Yes, here at Children's National, to advance into leadership positions, we do have minimum eligibility requirements from an educational perspective. The director level and above requires a graduate degree. We also place a high value on things like professional certifications. as well as, again, a sign of expertise in a specific area, be it clinical, administrative, or otherwise. So yes, the simple answer to that question is advancement does require minimum eligibility from an educational perspective. You know, I will just add that we've through the pandemic, I think we've allowed ourselves to loosen up a little bit in terms of BSN requirements versus associate degree requirements. And I'm really pleased to see that. We have about 92% of our nurses are BSN prepared when they come in, but given the nursing shortage, we've challenged ourselves to think a little bit differently about the associate degree nurse, a nurse who generally has longer years of service, who can partner with us and have the advantage of getting tuition support if they want to continue on to get their bachelor's degree. I've never met an associate degree nurse who wasn't an expert in terms of their practice of nursing, and we're really, really pleased to say that we're looking at this through a different lens and taking advantage. I also think the associate degree nurse helps to support our own goals that we have in terms of diversifying our workforce. And so, you know, that's one of many silver linings I think has come as a result of this pandemic, allowing us to look at this as an opportunity. And we're doing so with a lot of energy and a lot of good outcomes today.
Thank you. And thank you for the kudos to associate degree nurses. I hold that near and dear to my heart. Next, we'll have Dr. Murray.
So yes, it is required. Definitely for moving up, you have to get a doctorate degree. Many of the faculty members that come, even at the assistant professor level, have a doctorate degree coming into education. You do usually have to be a tenured faculty member, and also rank. Sometimes they have to have a rank of like associate professor or full professor. They have been published. They also do grant writing. They are members in national organizations, regional or local organizations, and they are usually officers in those organizations as well. And they present nationally, regionally, and locally. So there's a combination of skills that come together, but the education does matter.
Thank you. Rear Admiral Mix.
So the Public Health Service and nurses within the Public Health Service are really positioned rather uniquely. So as a uniformed service, we have ranks, we have military ranks, right? And so there are expected levels of leadership that correspond to the increase in rank structure. At the same time, our, what we call our day jobs, right? We are assigned to various agencies within the Department of Health and Human Services, as well as across the federal family. So in the question of does advancement to leadership positions require an advanced degree, that's very position specific. And so if the requirements for the position require that level of education, then certainly. But as a service, there is not a requirement, that every PHS nurse officer have a doctorate degree, for example. What we do have are qualifying degrees. And so in order to actually be commissioned into the United States Public Health Service as a nurse, you must have a bachelor's degree in nursing. So the BSN is the minimum requirement for commissioning. We do have many advanced practice RNs who of course have graduate degrees. And then we also have many of our nurse officers who do continue on to get their doctorate degree. I actually obtained my doctorate in nursing while on active duty, right? Was it a requirement to be chief nurse? Absolutely not. Absolutely not. Do I feel that the skills and the information and education that I received helped me to be a better chief nurse? Absolutely. My focus was on educational leadership and as a public health nurse. So that has allowed me to bring those two together in a way that I would not have been able to. And in addition, to help 1,300 other nurses understand what that perspective looks like and how to actually come together to make a difference. So I think there's the room for the formal education that is very position specific, but what leaders across the Public Health Service have in common is that desire to be lifelong learners. No one stays at the level that you came in with, whether you achieve a new degree, you get another certification, or just some continuing education ongoing. We are all lifelong learners, regardless of whether we actually go for the advanced degree or not.
I agree with that. And Dr. Daw.
Well, I'm kind of in a unique situation because I'm the only nurse in my entire agency of, I guess there's 75 coworkers. But essentially, it's just like Linda said, the directors are expected to have a graduate degree. And then our grants department, we did have a doctorally prepared person over the grant as the grants manager. And then when she moved and someone moved into her position, she's bachelor prepared. So a leader, you know, they have a minimal, like you've talked about, and then you can advance above that. You can come in with more credentials. But essentially, they didn't require me to have anything beyond a master's degree for my position. And I was newly a graduate of a master's program. So I learned a lot in this position. And the person before me was not a nurse. So I'm the first nurse this agency has ever had.
Wow.
It's
Round
very.
Yes, clap, clap. I saw that Rear Admiral mix. So, so you see, we can be pioneers in our fields, right? And, you know, but I do encourage everyone to go back, get the education, and become mentors for those who are trying to pursue their education. I did a mentorship at Salisbury University, and I see Dr. Tina Reed is on, and she can plug the information in the chat. But they actually mentor and train nurses to be preceptors, mainly for clinical preceptors, but I would take the time to explore what opportunities they have if you're interested in mentoring nurses for the next level, because I find that a lot of times, especially with the nurse practitioner students, they don't have preceptors for each discipline that they have to do. So it's important that we give back, because we have to remember where we were when we needed a preceptor and how we felt. So I think it's important for us to give back so that we can reach those levels of professionalism. Okay, I'll start with Dr. Murray this time. What financial supports incentives do your organization offer to encourage nurses to pursue advancement? I know you are in education, so this might be a tricky question for you, but we're all ears.
Well, because our institution is in the university system of Maryland, the incentives that they offer is tuition assistance. So like, for example, if you had an individual come with a bachelor's degree, they can get tuition assistance for any of the system schools, and they may go to advance in whatever degree that they decide to select. We also do have, the university offers monies for professional development, travel to conferences. In our particular college, we also offer up to $1,500 per year for faculty members to advance themselves. We have monies towards certification, national certifications, and then we have individuals who engage in faculty practice. And those individual faculty practice, they get incentives towards their liability insurances and also their certifications.
Thank you. Ms. Talley?
Likewise, here at Children's, we have 100% tuition reimbursement for nurses who are seeking their bachelor's degree. We have 50% tuition reimbursement for nurses who are seeking their graduate degree. We also support conference attendance through travel and hotel, et cetera, especially for presenters, you know, either podium or poster presentations. We reimburse for certification costs and give a recognition bonus actually to nurses who obtain certification within a professional organization. And here at Children's, we have an innovative program called the Conway Nursing Pathfinder Program. Many of you may be aware of Bill Conway, and he supports a lot of scholarships within the state of Maryland, both at Hopkins, I believe, and the University of Maryland. He has partnered with us here at Children's, and this is a scholarship program that provides 100% tuition reimbursement to high school students, associate degree nurses, bachelor's degree nurses, who are, and they act as mentees, and they're paired up with mentors who are Children's national nurses who are seeking either a graduate or a terminal degree. Likewise, the mentors get 100% tuition reimbursement. We, to date, have approximately 66 students, mentors, and mentees in the program. And our aim is to study those factors that are most closely associated with long-term retention through these students who are active participants within the pathway program.
Thank you. Retention, that's what's important. That's what will cure our workforce shortage, right?
I
Rear
hope
Admiral, yes. Rear Admiral Mix, this might be a little tricky for you. It's the federal government, so.
Yeah, even within the federal government, we do have some resources. I mentioned that our nurses are assigned to various federal agencies, and so there's certainly financial support and incentives that are inherent to the particular agencies. Many of our nurses, depending on where the nurses are assigned, actually have access also to HRSA's programs. So that would include the National Health Service Corps for advanced practice nurses, as well as the Nurse Corps program, which is available to RNs as well as APRNs. And in both of those programs, there are opportunities for loan repayment as well as scholarships. And then, as I mentioned, as a uniform service, all of our PHS officers actually have access to the post 9/11 GI benefit. And so what that means is that we have an opportunity for support for not only tuition, but housing, books, and supplies that are related to education. And that's not just degree programs, but it's also advanced education, which could be in the form of a certification as long as it's eligible. And I will say that the GI Bill is actually what I leveraged in order to obtain my doctorate. And then I was also able to then transfer my remaining benefit to 2 of my daughters to help support them as they continued. So I have one that graduated and one that's a freshman this year who is also utilizing those post 9/11 GI benefits as well.
Thank you for sharing, and I'm glad that you brought that up because public service through the military, United States Public Health Service is sort of like a derivative, if I can remember, of the military population. And so I considered at one point, Rear Admiral Hunter talked to me about it, and I considered at one point, but I chickened out. So, but I'm glad that you mentioned that because there's so many benefits, and as you mentioned, we have benefits within HRSA for nurse loan repayment programs. And so one of the District 5 members will enter that information in the chat. I feel like HRSA is like the best kept secret of the government for healthcare professionals. And so if hrsa.gov, we'll put that information in for you all to explore. And lastly, Peg Daw, you hold the scholarships and things like that. So share with us what financial incentives that you all have.
Well, our agency, the Maryland Higher Education Commission, they have an entire department called the Office of Student Financial Assistance, and they have state nursing scholarships, workforce shortage assistance grants. They have some type of loan LARP program. I mean, they have 14 different programs, but they're not all for nurses, but a lot of nurses have benefited from them. And then the Nurse Support 2 program that we administer, they have great resources for faculty. Our focus is on supporting educational programs to have the capacity to educate students at every level, but our focus is on our faculty, because if we do not have faculty, we cannot have graduates. So we have 5 faculty awards. One of them is called the Cohen Scholars, and that helps people to complete a graduate degree to be prepared to teach. The next one is the New Nurse Faculty Fellowship, and that is for new faculty who come on board, and it's now a 5-year award, $50,000 over 5 years. So if you go to an academic setting and you kind of indoctrinate in the culture and become part of the system over a 5-year period and learn what you need and that you continue there, then you get $10,000 each year. And then our other program, the Nurse Educator Doctoral Grants, that is for people who are current full-time faculty, and they have put in the time, they have the expertise, but they want to finish their doctoral program, and we don't want them to be overloaded with debt. So there's up to $60,000 available for current existing nurse faculty who are full-time to access that funding for their doctoral programs. And then we have the Academic Nurse Educator Certification. Now, I'm really excited about this because it is advancing the expertise of our faculty, the NLN, CNE, and our goal is that half of our full-time faculty, 300 people here in Maryland, will achieve that certification well on the way. And then the last one is the Nurse Faculty Annual Recognition Award. They could use that as well to recognize existing faculty. And what I want to tell you is that every program, the 4 faculty programs, have a long list of options. It can be tuition, loan repayment, it could be professional development, conferences, travel, presentations, it goes right down the list. So we have been very liberal in how our faculty are able to utilize the funds.
Thank you. I appreciate it. Such great information from all of our nursing leaders. They're teaching us how we can advance our degrees and what steps that you can take within their organizations if you choose to join, to where they're assisting you, helping you get those degrees. And look into the United States Public Health Service. It's a great opportunity to work as a nurse and continue the mission. Okay, so what advice do you have for nurses that are considering leaving the profession? I would say don't do it, but I might be eating my own words because I've considered it over the last year because I wanted to do something else, but something is still holding me down. So what advice do you have? I'll start with Dr. Murray.
Thank you so much. I would first off want to make sure before I spoke to somebody if they were really asking for my advice or if they just wanted me to listen. So that's really critical. But if they did ask me for my advice, I would just really want to make sure, like, what is it they're trying to do? What is it part of their journey? What are they seeking to do? That's so critical. And sometimes people just don't know what they're trying to do. So, but they may be frustrated where they are. And maybe they have to just kind of like verbalize some of those components. Maybe they have to get more work-life balance. Maybe they're not really thinking about leaving the profession as much as they may not know about all the opportunities that exist within nursing and many different things that they can possibly do. So maybe they didn't think about like school nursing, or maybe they didn't think about home health nursing, or maybe they think about like occupational health nursing or some other aspect. But there's a variety of components that they can do. I would also probably think in my mind, if I was talking to them, does a nurse really ever leave the profession? Because built inside of them, they're still wired for nursing, whatever they do. Even if they go into business, they're still possibly thinking about that assessment process. Their lens has been shaped in that way. So no matter where they go, as long as they're making an impact on health, health equity, and whatever they can do for individuals, whether it's for populations, groups, or organization, they're impacting nursing. And we can't always think that nursing is just a traditional at the bedside nurse. Let them expand their wings and let them grow.
Thank you. And that's the key, you know, changing what you're doing in nursing might be the answer before considering leaving the profession. Okay, Rear Admiral Mix.
My answer actually combines the two of yours. Really, I'm never going to encourage anyone to leave nursing as a profession, right? I also am one to always say nursing isn't what I do, it's who I am. So I also agree with what's said is it just becomes our way of life and just the lens that we see the world through. But more specifically, because I think more and more we're finding that nurses are asking the question. And as it relates to the public health service, you know, Admiral Mix, I'm thinking about leaving the public health service. So these are very real conversations. And so again, I come back to the why, right? So encouraging the person to really revisit why they became a nurse in the first place, right? Then considering what are the reasons that are pushing the person to make this decision or even consider the decision to leave the profession. As a nurse, of course, I respect every person's right to make the decision that's best for them. And that respect is also given to every nurse across this country, right? And so we have to trust and believe that people know what's best for them. So what is important for me, though, is that the nurse in this instance, you know, make an informed and intentional decision as opposed to a knee-jerk or just a purely emotional decision, right? So with that, you know, so it's tell me why you became a nurse. What part of that is missing right now, right? What part of that are you not able to do in your current position? And then the third question is, you know, where can you see yourself actually being able to practice nursing in the way that matches why you became a nurse in the first place? And then the conversation becomes, where can we find that, right? Because either the person might not know that that opportunity exists somewhere. They might know that it exists, but not really know exactly how to get there, right? Or they just realize this is just not for me. This just, it really is not me, right? And so the next steps actually align with one of those three options. And so whether it's connecting someone with a mentor, whether it's connecting someone with a coach, you know, again, providing that support so that whatever their informed decision is, that they can actually be supported in whatever that might be that's best for them.
All right, thank you. And you're taking us back to remembering your why, something that was mentioned in the beginning, and your passion. Because when I tell people that I consider changing professions, they know how passionate I am about nursing, and they thought I was, losing my mind. So, it's always remember to dig deep and to go back to remembering your why. So thank you. Ms. Talley?
Well, I'll tell you, there's such great advice here. I'm like a sponge. I'm taking it all in. I really, I've learned a lot. Someone gave me some advice early on in my career, not to run away from something, but always make sure you're running towards. So I think, we've been through such a horrific, time in so many ways. It's induced a lot of pain and emotional and moral distress that we really weren't well prepared for. And so I'm not surprised that this has created an atmosphere where we're all, second guessing or thinking, or maybe we're looking at opportunities through a different lens than we did pre-pandemic. But I like to look at that glass half full, and I like to talk with my staff about the silver linings, and I like to talk about the future. And I think there were many silver linings through this experience, and I'm not trying to minimize. We have to address the pain that has been associated with our experience over the past 2 years. But I do think about the amazing support that we received from the community, how it lifted up, and I think was so affirming for so many of us. And I think about this is our calling, and it's like the future is ours now. All of the things that we have advocated for so many years around health equity, the fact that now we can use our position within healthcare to talk about social determinants of health and how that informs our, assessment of individuals, that we might really be able to achieve this idea around equity, that everybody has a fair chance at a healthy life and a full life potential. That is something we've been waiting for a long time, and might be this opportunity that comes out of the pandemic. That in fact, the future does look really, really bright. We get to begin to think about how we act as leaders, as educators, as advocates, as quality experts to inform what the future of healthcare is going to look like. And again, to advocate. We learned through this experience the disproportionate impact on those who are not well represented or don't have easy access to healthcare. And I think it just speaks to who we are. I think it speaks to that primary drive that we all had when we made those decisions early in our career to become a nurse. And I think there's a lot of opportunity to come. So, we recognize that this is a time of self-reflection and a time for all of us to think about our lives in the context of the pandemic. We have had many of those conversations, needless to say, with staff on the front line. But I just caution them to say, don't run away. The grass is not greener necessarily on the other side. I love one of the earlier comments that the nurse within will always be a driving force for us. And I think that there's no better time than now as we begin to anticipate what recovery looks like and how we're going to show up and how we are going to be able to advocate and heal this country that is in such desperate need of healing.
Thank you, Ms. Talley. Social determinants of health, that's very, very important and a hot topic now for healthcare organizations, health centers, for HRSA. Even when I do utilization review, I notice that they've entered social determinants of health as a question that needs to be answered. But do we have the resources to provide what people need once we assess and retrieve the data? So Dr. Dahl?
I cannot even add anything to what my colleagues have shared because, my first thought was that nursing is a calling, it's an art and a science, and that we have put our hearts out there. And it's no wonder that people would think about leaving. You can think about a lot of things, doesn't mean you're really going to do it. So sometimes you kind of have to step back. And I remember what an elderly nanny who took care of the little boy next door, and they were moving. And I walked over and I asked her, I said, so Lena, what are you going to do? And she told me, she said, nothing good or bad lasts forever. And we have to keep reminding ourselves that we're in that position. And the other truism is, don't seek a permanent solution to a temporary problem. So I just think that we have to give people truth, and we have to remind them why they went into nursing and to hold on. Even if they have to step out, do part-time, flex, shift into another role, like Dr. Murray was saying, just find a way not to give up your heart and soul.
And there are endless opportunities in nursing, endless opportunities in nursing. As one of the District 5 members mentioned, nursing is very fluid. And so we're going to take a break right now and do the poll, but I wanted everyone to know to please look at the chat. There's lots of valuable information in the chat, from scholarship information to information on the Robert Wood Johnson Foundation. Please take the time to look in the chat for the information so that you too can be successful. So ladies, we'll pause for a minute. If you need to grab a drink, a sip of water.
Well, wait a minute. We want you to answer the questions. Please don't leave.
Yes.
Because
Yes.
I'm going to release the poll. You're going to see a few questions come up on your screen. There are only 3 questions. You select the answer that you believe is best for you. And so, wait a minute, my polls. My polling questions are not coming up. So they can have a break and I'll redo the poll.
Okay. Technology, right? Sometimes these things just happen. So thank you for your patience.
Yeah.
And Dr. Bell, thank you so much for being here with us. In addition to what you have just reminded or guessed that's in the chat, there's also a link several times in the chat about how to join M&A. And so if you are not already a member, we would like you to be a member, and we don't want to be partial in saying, once you do that, then also join District 5. Shameless plug for District 5 that's sponsoring this evening. So again, lots of valuable information about financial resources and scholarships. And as we wait for the poll, Dr. Daw talked about the many opportunities available for MHEC. And I can say that I was a recipient of money twice, both for my master's and my doctorates from Maryland Higher Education Commission, which I used for both of those degrees. And the faculty, can't remember what it was called, the faculty support program, the grant that they had, that I also did for my master's in nursing education. So I just want people to know that it's just not information that's there. There are actually people that real people that actually get them. And I was one of those recipients, and I'm very grateful for finishing those degrees and not anything. So thank you. So for those of you who are interested, there's very valuable information in the chat. Thank you.
Thank you, Dr. Holness. And also I see a lot of representation from the colleges. I see Chamberlain College of Nursing, Kiana Green. If Kiana, if you wanted to add anything about Chamberlain in the chat. I see Dr. Reed again from Salisbury University. And if you all are representing any of the universities, please put your information for your school in the chat. We have Dr. Murray, of course, our panelist from Coppin State University. And they have DNP programs. So please enter your information in the chat so that the participating members can look into your programs. Thank you.
Yeah, and Dr. Bell, why don't we just keep going while we try to see if we can recreate the poll? Don't know what happened to those polling questions. Thank you.
Okay, thank you. Okay, ladies. So, I see the
poll.
poll.
The poll is up.
Poll popped up.
Oh, so someone else is having control of it. So it popped up for you?
Yes, I have it.
There were 2 questions, Dr. DeWitty.
Okay.
Was it 2 questions you wanted?
There were 2 questions in the poll.
Yeah, and people have already started to answer. So I think we can just go ahead and finish that right now.
Sure, great.
Okay, we'll give it about a minute and then we'll enter our final question for the evening prior to the Q&A session. Thank you all for joining us.
Vernell, I was able to release the poll,
Great.
so it worked for me.
Yeah, that's what my system told me.
Oh, I don't, I noticed that the majority of people, oh, I know why. If you're a co-host, you're not able to do it. So I was wondering why it wasn't in the results, but being a co-host, I don't think you can do the poll, one of the co-hosts. So yes, it is going on. Thanks.
Okay, great.
But 86% of the attendees have responded so far. So that's looking pretty great.
Okay,
So all
good.
for
So-
doing this.
So Lou, will you let us know when about 75% of the respondents have responded?
We have
Up there to 80.
86%.
Yep,
Oh,
just a
okay,
couple more.
great.
We up to 88 now.
Okay, great.
All right, now we're at 91.
All right, thank you all for participating. This is very important for us. As we know, data, right? Data is important.
All right, so we just missing a couple of people, so I'll end it and share it.
Okay,
Okay, you should see the
Listen
results.
are the hosts.
wow, okay. So I hope the 5% are influenced after tonight to join us.
71% is a member. So,
That's excellent.
and then the majority was from Prince George's County. Few people from the District of Columbia and 17% from Montgomery County. Because D5 does represent Montgomery County, Prince George's County, and the District of Columbia. So that's why we were wondering where everyone was kind of coming from. And then I think in the chat, someone said they were from Baltimore, maybe?
District
And then other
9.
was 44% was from other counties than what was listed, so.
I'm happy to hear that because that means that this messaging spread across the county. So it's good to hear that it didn't stay just close to home.
Yes.
Okay, thank you, Lou.
Thank
So-
you, Dr. Bell. You can continue on with the last question.
Thank you. Okay, so as we look 5 years into the future, what do you envision for the nursing profession? I believe one of you mentioned 5 years in the beginning of the conversation. And so would you like to start, Rear Admiral Mix?
Sure. My theme, I do a vision board every year, and 2022 was a back to basics, right? This applies in answering this question as well, because my 5-year vision for the profession is a back to basics. A lot of the new things that people are talking about are the things that nurses have been learning since the beginning of time, right? A focus on person, health equity, making sure people have access, social determinants. That's what we do. So my 5-year vision then is that we actually have more nurse-driven and nurse-informed care models that connect and coordinate care across the health continuum. Health and healthcare actually exist where people are, right? And so what that means is knowing that people are not just in hospitals, we have to make sure that we're building up our nursing workforce in community-based and population-based areas, right? That is the one way that we as a profession can also help to release this burden and this extreme pressure that our colleagues in inpatient settings are currently experiencing. How can we get to people before they get to the hospital? How do we get to them after they get out of the hospital to make sure that they don't return? I truly believe that we need more nurses in leadership roles and decision-making roles so we can make sure that we can get this right, that we can do this better and the way that we know that it can be done. It's also important that we are preparing nurses to address the needs of marginalized populations, right? Those that don't have access, and so we need to go to where they are. Again, community-based interventions. So, nurses inherently as patient advocates, community advocates, so that means whether our patients are individuals, families, communities, populations, we can get it done, right? We're also usually the central part that everyone will come to, no matter what discipline they represent. If you want the question answered, you're going to come to the nurse, right? So we need to leverage that. We need to own that. We need to be proud of that, and we need to be more vocal about it. So a more vocal presence for nurses and the nursing profession that actually highlights this art and science of caring, which is really what we bring to the table. So I think really, it's the opportunity for nurses to lead the charge in collaboration and engagement for comprehensive services, both physical and mental and social, that will get to this health equity piece that we're all striving to achieve.
Thank you. What a combination of of suggestions for nursing. You know, I often thought we might need a nurse-led hospital and nurse-led organizations as opposed to non-nurses. And so I hope to see that one day, because nursing is a holistic approach. You know, I often hear people, and not to knock physicians, but they prefer to go to a nurse practitioner because you get that holistic exam, you know, and nurses care. And that's a big part of what we do. So thank you, Rear Admiral Mix. I'll go to Dr. Daw next.
Thank you. I really feel like that we're at a crossroads. I've been in the profession a long time, and I actually was fascinated with Dr. Beerhouse's work because he watched the shortage go up and down. And, you know, we've been dealing with this situation, and the pandemic has exacerbated it. So I feel like that we're really at a crossroads as far as we've seen. I have impact data. So I've seen that graduates through 2020 were pretty steady, but enrollments were dipping in every profession, including nursing. Not dipping drastically, but dipping. So we have to keep our eye on that ball. Like, is nursing still an appealing profession? So we're, as far as I'm looking at it, we hear from nurses, we hear from them. We have surveys, we have, you know, news reports, we have studies, we have research. We ask them personally, you know, why are you leaving this position? You know, we have colleagues who tell us what's going on in their life. And what I'm hearing is they're concerned about their working conditions. We talked about that. But also I hear that they're looking at, you know, a lot of times administration will come in and say, well, nurses don't care about salary. They don't care about money. That's not true. You know, they're imagining that nurses don't care about salary or money. But if you look at Maryland, I saw a statistic recently that we look like we're above the average in salary, but we're really 49th because we have a cost of living that's higher than some other areas, and our salaries are not up to that state. So, you know, just a basic HR department could do a comparison and get us up to a level, an equitable level to consider the cost of living. So I'm just thinking that we have all this information, but as you said earlier, we don't necessarily have nurses in a position to make these decisions. So I see that if we take this information and we join forces and we have our nurses stand up and speak out and lead, we can go in a great direction because we have great resources. If we don't, if we allow other people, governmental or other disciplines, determine what nurses want or need, we could go down a different path. And we're really at a point where we need to speak up.
Thank you. Thank you very much. Dr. Murray?
Okay, thank you. I think we're going to see more nurses that become entrepreneurs. I think they're going to think about the business of healthcare and also the business of what they can do. I know that I think that even baccalaureate and also associate programs should have that foundational information about thinking of yourself as a business, because many individuals are going to see how much monies, I think they understand already. They've seen the economic components and the other individuals around them that maybe are making more. They're also seeing that when they go and get the doctoral degree, and I think I saw a comment about that, about how to get your return on your investment, that they see that, you know what, they have individuals who are not their counterparts, not their equals, who get a master's, like an MBA, not to minimize the MBA, but they've more so quantified an MBA in a better way. And even in the business curriculum and some of the accrediting bodies, they have done a better job at making sure that there's a way wherein they help to understand, even for the faculty members, how much they're going to get paid based on a certain amount of the workforce demand and some other components. But I think that we're going to find that when they sit back, and I think the pandemic has helped to disrupt people's abilities to just get in that work grind and to sit back, they're going to wonder, why am I not getting compensated for all of this knowledge that I have in my head and in my heart? And then they're going to probably look at ways wherein they can do it better. And even if they don't, industry, through places like LinkedIn and other buzzwords that they use, are going to seek them out, and they're going to cannibalize nursing if we're not careful, because that those industries are going to penetrate in ways we cannot be able to deal with from the hospital levels and other areas. And nursing will continue. I think this has shown us like we've got the most critical people in the beds already. And then we are going to find that home health care is going to be very much evolved. And I see avatars and other predictive analytics and artificial intelligence is going to be necessary, but maybe avatars that are visiting some of our older individuals in their houses, because it's a way to supervise them and monitor them. And you see some of that possibly going on today with some of these echoes and other types of systems that are in people's homes. But I would also like to see there be an increase in the amount of Black, Indigenous, people of color in nursing overall. Been in nursing about 30 years. And if we're at 20% then when I probably started, we're about 20% now. And I would like to see that change.
Thank you. And I would say to piggyback on that, that I see in 5 years that there will be more nurses because, like you said, the admission rate for nurses, is at a certain level despite the pandemic. And I'm so proud of the students and the mentees that I have that have continued their education through the pandemic, and they saw what was going on, but they still kept true to their why and why they wanted to go into the profession. And nurses are resilient. And so I think that if we serve as positive influences, we will begin to see a turn in the future of nursing. And we'll close it out with Ms. Talley.
Much. Such a great and thought-provoking question to close with, so thank you for that. I see a bright future. I see a future with more doors open than closed. I see some of the barriers removed that existed before the pandemic. I see nurses fully actualized in their role as leader. I see nurses as educators, as advocates, as healers, as innovators. My gosh, on a daily basis, especially in the beginning of the pandemic, it was just awe-inspiring to see what nurses on the front line were doing. Yes, in terribly anxiety-ridden situations, but man, the innovation that they were able to drive all together in a collaborative way, networking with one another and with disciplines across the system to do what they had to do. I think that innovative spirit was really ignited for many of our nurses on the front line. It turned into opportunities to advance nursing research and nursing science, quality improvement projects, having a seat at the table where decisions were being made about supply chain, which in N95, were we going to drive the highest degree of compliance with our PPE requirements, et cetera, et cetera. Nurses were informing that plan. They had a seat at the table, and they were fully actualized again in their role as leader, educator, advocator, and innovator. In 2001, back in May of 2001, the Future of Nursing document was released a year later than anticipated because the team that was working on the document were pretty wise and realized that the pandemic was going to inform further the recommendations that were coming out of that document. And we studied that in depth here at Children's to find where those, paths are that are going to, again, help us to achieve this vision of health equity for our nation and for our communities. And I think there's some really positive messages within that document. I'm not going to try and summarize it here. It's 600 pages long and free download and some good evening reading. But with contained in that document is great hope and a great vision that is set there before us, and it's there for the taking, and it's waiting for us to embrace and to find what our place is, in terms of driving us towards that future. Again, a future that states really clearly that this idea of health equity is now within our reach, and that nurses are ideally prepared, credentialed, educated, and suited to drive us towards that reality.
Thank you very much. It's been such a pleasure hearing the words of wisdom, the pearls of wisdom, the nuggets that we received this evening. Thank you very much for participating in M&A District 5's Nurse Wellbeing Series. We support you all as well. United States Public Health Service, we were able to donate meals from the M&A during the inauguration last year. I don't know if you all recall that, but that was the Maryland Nurses Association. So we support you, we support the students, we support Children's Hospital. And so thank you. I can't say it enough. And so now we're going to enter our Q&A session, and I'll turn the session over to Carol, Dr. Holness. Thank you, ladies.
Thank you again. Thank you so much, Dr. Bell, for facilitating this discussion this evening. We at District 5 appreciate your presence. For everyone that is here this evening, or heartfelt appreciation to our stellar panelists who shared their passion and commitment for the profession of nursing. I have 4 questions for consideration right now. But before I do this, I just wanted to echo something that Diane Breckenridge put in the chat. I'm sure you all saw that. And I want to just read that before I ask the question. And she said, this was very helpful, this presentation, especially about our ADN nurses. And I actually teach in an ADN program. She says, as a PhD grad under Dr. Mary Etta Mills at the University of Maryland and a postdoc at Penn, I was mentored in grant writing and just assisted ELAC in Los Angeles, which has 96% Hispanic students, to obtain a Song Brown grant to use strategies for success to improve their NCLEX rates above 75%. And she said yesterday, they received $320,000, and the Harkin faculty, students, and directors are so positive now. She continues, in the last 3 months, we've been able to raise the pass rates to 77%, and their goal is to be above 80% this semester. She states and concludes, staying positive is the answer. And that is just so heartwarming to see the work that nurses are doing, not only where we are, but helping the underserved around the country. So the first question that was posed in the chat, and I think we can just have 1 or 2 people answer this in the interest of time, as it's applicable to you in your discipline. Can the panelists respond to the lack of, as it says, ROI, return on an investment, for nurses with advanced degrees, such as master's and doctorate, who prefer to remain in direct patient care? So I'm just, whoever would like to answer that, the lack of return on investment for those with graduate degrees who choose to stay at the bedside.
This is Dr. Murray.
Okay.
I just want to say that if we don't have the conversation now or before you go for the education, it's kind of hard to speak about your return on the investment after you actually go to have your education. So it's a value proposition, but I think that we need to know, like, what are you bringing to the table? And we haven't done a very good job of distinguishing between our master's or doctoral degree and some of our other degrees and what brings to the table. But you can see that many of the hospitals have been taking many of the individual doctoral preparations or other levels of preparations. So the conversation would be, what is the distinguishing components and what are they bringing to the table? And nurses are like, they're CEOs, your business entities. Like I said, if you compare yourself to other types of disciplines that we could do them more often, we really could get a better return on our investment if we had that conversation on the front end. So that's part of what we need to be doing and thinking about how we can sell that conversation and quantify it more appropriately and make sure that we don't care about what our education is. We have had a lot of times we speak to lobbyists or speak to people that are in legislation, they break up our conversations because we get divided about the kind of educational preparation we have. But just as long as you have a seat at the table, make a difference and make sure we can quantify what nurses bring to the table. We bring a lot.
Thank you so much for that. I'll have Ms. Talley respond in just a second, but just want to echo what Dr. Murray has said. We do have a seat at the table, and there is some information in the chat about the Nurses Night Out that's coming up very soon. The deadline to register is December 15th, and that's a place where we can gather together to meet our legislative members and let them know what we're about. So thank you And I'll just ask Ms. Talley if she could answer that as well, knowing that she's working in an entity where there may be people that decide to keep their advanced degrees, but also be in direct patient care. Can you respond to the lack of return on investment for those nurses, please?
I certainly can, and I really appreciate the question, because I think it comes at a time where we are challenged in terms of thinking about different and new ways to deliver care at the bedside, and perhaps this is that opportunity to look at the credentials that our nurses have at the front line to inform changes in our care model that we're going to have to make. There's not a return to pre-pandemic times. We've changed too much, and we are wiser for this experience, and we will need to accommodate and adjust the way that we deliver care in response to this pandemic that we've been through, number one, and out of an abundance of caution, because there will be another disaster, man-made or natural disaster. And so one thing that we're working on hard here is to really examine our care model and align opportunities to redesign that care model with the credentials, the education, the expertise, the experience that we have among the nurses at the bedside. So I see, again, I'm going to call this a silver lining for those nurses who have those advanced degrees. I see that there's great opportunity to actualize them to the degree that they can practice to the top of their credentials and help us to redesign, gain some efficiency in the way that we deliver care, and to help us by really, being able to leverage their knowledge, their wisdom, their skills in a different way. The old way of delivering care is not sustainable, certainly not in the current workforce shortage. So I think out of this comes an abundance of opportunity. I'm really thankful for the question, because it gives us something to think about.
Yes, absolutely. Opportunities are available. I'm not sure if our other two panelists have a brief comment on that about the lack of return on investment, or otherwise we can go to the next question.
If they don't, I would like to add, the investment is in yourself.
Yes.
The investment is in yourself first. Your knowledge, just like your health, is your wealth. So invest in yourself first and think of it from that perspective.
Yeah.
Okay, thank you. And so the next question, as we're closing out, please speak to ways to make the transition from RN to APRN after obtaining education. This attendee said, I've found many positions for APRNs are asking for 2 to 3 years experience. How does one overcome this hurdle? And so in the interest of time, we'll just ask one person to address this in the last two questions. Making that transition from RN to APRN after obtaining an education, now they want 2 to 3 years experience. How do you overcome that hurdle? Maybe if Dr. Mix or Dr. Murray, maybe.
I'm going to try. I'm going to just say two
go
things.
ahead, Ms. Talley.
Be in an academic setting, because I think I think there's a different trajectory available in an academic setting, and get active with your legislators, because that's where some of the policy makers, depending upon which jurisdiction you're in, make that it can really be a challenge, frankly. And I see, because we have nurses who practice in Maryland, the District of Columbia, and Virginia, there's great variability in terms of how APRNs are able to practice. And I think we've got to connect with our teams and advocates in our government affairs office and really make sure that we are informing, taking advantage of our proximity to Capitol Hill and to our respective jurisdictions, so that we again are informing some of the legislation and restrictions that are in place that make that more difficult.
Thank you so much. And again, the plug for the Nurses Night in Annapolis, where we can begin that conversation. Or third, and then question is, could you speak to transition from many years of leadership to nursing education? So maybe Dr. Murray can speak to, I'm not sure, many years of leadership to nursing education. or Ms. Daw, Dr. Mix, whoever wants to take that question, and we have one more.
Well, I'm going to say from people that have actually, whether we've experienced that have gone from that transition, that I don't think that it's been a problem. I think that they are definitely, they're well received, value added. It might be the change in thinking that probably is maybe the, sometimes when you're working in certain positions, there's more agility, and higher education doesn't have the same level of agility. It's process oriented. So that probably is maybe a level of, it's a difference, huge difference, but it's possible and anybody can do it. And we welcome all people to the table and bring the value added.
Thank you so much.
And I can-
Final question, and Dr. Mix, I'm gonna have you start with this, but I'm gonna ask a final question and give everyone 1 minute to summarize this question, and then I'll have you give your comment first, Dr. Mix, and then the question. Finding a PRN can be very challenging. What advice would you share for nurses who work in program management or education and who also want to stay current with their clinical skills? So after Dr. Mix speaks, that's the final question. Just 45 seconds for everyone. What advice would you share for nurses who want to work in program management education and who also want to stay current? And I'm one of those nurses that is in education, also current to the bedside. So Dr. Mix, and then everyone 45 seconds, and then we'll close. Thank you so much.
Got it. And I mean, this question, it relates to the NP question, to the transition to education, and this one. It really is, how do you maintain the full complement of skills? There are absolutely formal programs to allow it. So whether you're talking about a nurse practitioner residency, whether you're talking about training in nursing education, or this specific question, refresher programs that are offered by the respective state boards of nursing, where they've identified programs across your state that will allow you to then go back into gain clinical skills so that you can show competency, because it's not enough to just say, I can do it. You've got to actually show proof. So I think it's seeking out those formal trainings so that you can refresh your skills to today's nursing skills, which might be different than the nursing skills you had when you came through your pre-licensure program.
Okay, and advice to nurses who wants to stay current in their skills, clinical skills, and also stay in their program management or education. Should they do it?
I can answer that one because
yes, Dr. Bell, as we close out.
So because I work as a nurse consultant for HRSA, and I also still work as a nurse case manager for Kaiser Permanente. So I still am able to use my nursing knowledge and frontline experience. I've worked throughout the pandemic with patients, discharge planning, utilization review. And I think that that's what keeps me on my toes. I'm able to take that same knowledge and apply it back to being a nurse consultant with HRSA and dealing with that population as well. So if you're willing to take on more than one role, which we always wear many hats, but that's the way that you can keep yourself in the forefront of healthcare, because I think that is important also when you're talking about like healthcare policy, keeping yourself in the forefront of practice.
Absolutely. Firsthand experience is so important to bring because we know exactly what's happening on both ends of the spectrum. And so I thank you for that. I don't know if we have another 30-second comment on that, and then we will be closing out the question and answer.
This is Dr. Murray. If I can just add, I also work as the director of 2 health centers. I've done a lot of stuff with COVID as well, a nurse practitioner, and I have helped people still to manage their care, even as a nurse practitioner. Even if it's 4 hours a week, you can still do that. But as an educator, we also do have faculty practices that we encourage individuals to educate, but also faculty practice in our health centers. So there's many ways to blend everything together.
I would like to highlight, thank you so much again to our panelists, but I would like to highlight one final thing in the chat in regards to that question about the APRN, where a representative from Johns Hopkins says they are hiring new grad APRNs at Hopkins. So you can share that with your colleagues and friends that are not here tonight. This, the person, let me see, this is Yannette says, I am the Director of Nursing for Oncology and would love to share your CV with our APP leaders. So for those of you who are in that boat that are interested in that, or your colleagues or friends that are, Hopkins is a place to send your resume, and the contact information is there in the chat. So I just thank you so much to our panelists. I think I had asked for 30 seconds. I don't know if And Dr. Daw, you have a final word, and then I'll turn it back over to our D5 president. If you had a closing thought, anyone, and then we'll close. Thank you so much.
I would like to share that when a person goes into management, they need to keep thinking about their clinical role. So if their specialty, like my specialty was psych mental health, I maintain contact with that department. And most hospitals have a PRN pool. They let any nurse sign up for this pool. So maintain your credential, your certification, and your specialty, and they'll be asking you to work PRN.
Absolutely. And as I said, that is what I'm doing. I'm teaching a full-time faculty, but also still working PRN. And it's really great for my students as well when I take them into clinical practice to kind of know what's happening and not just dependent fully on the theory in the book and what the book said or says. So again, thank you so much for being here. We really appreciate you on behalf of District 5. Thank you so much for coming. I'm going to turn it over to Lou and or other co-hosts for the closing remark. Thank you, Dr. Mix, Dr. Daw, Dr. Murray, Ms. Talley, and Dr. Bell for facilitating our panel. We really appreciate you being here. Lou, over to you.
Thanks so much, Carol. I'd like to, just close listening for the last hour and a half. It's been amazing. The questions that were asked, the answers that were given and provided to us. I'm actually completing my DNP program and in executive leadership also, like some of you also have. And my project is on nurse mentorship and developing programs, customizing mentorship programs for each organization, because every organization is so different and they have to be sustainable. And to hear, Ms. Talley speak about how children's participates in all these different support for their nurses and provides mentorship, and they have such a great collaboration with other organizations. It has touched me in so many ways with so many things that everyone has said. I appreciate all of your time. I hope people that may not be members of M&A D5 may go to our website, check out our website. You can look at M&A website also if you would look into join one of the other districts if you're not in one of our areas, but we're happy to have you. It's just been wonderful to hear all the people that we've had from across the country, from California to Pennsylvania to local and all region. I think this is the first time that D5 has had people pretty much across the country almost. And so, Diane, keep doing the great work that you're doing over there in Los Angeles. And before you know it, those scores will be in the 90% of NCLEX pass rate. So keep going. We would love to hear more about how that goes. Hope all of you, as you can see, we had great networking tonight. We have people from Hopkins that's wanting people's CVs, and they can pass on that information. So it's just been a wonderful night all the way around. Thank you, Ms. Talley, for joining us. Rear Admiral Mix, it's been a delight. It's unbelievable your insight that you've given all of us, and then also Dr. Murray and Dr. Daw. And we couldn't have done this at all without our wonderful moderator, our M&A Vice President, Dr. Melanie Bell also. So I want to give all of you a big round of applause. And if anyone has any questions or has any feedback or anything afterwards and needs to get in touch with M&A D5, you can find us on our website, and you can have the links directly to our email addresses. So please let us know if anything else. Other than that, we will let everyone go and have a great evening.
Thank you.
Bye-bye.
Will the planning committee stay on for a minute, please?
We sure can.
And everyone be safe. Thank you so much for being here. We look forward to connecting with you again.
Well, I'm not on the planning committee. This is Jacqueline, the executive director. I think I've met most of you. I just want to congratulate you on an
Hi,
amazing
Jack.
event. This was absolutely amazing. So I mean, I just love how we tied in so many things, in terms of, just recruiting members, talking about upcoming events that we're having. You guys did an amazing job this evening. It did not even feel like I've been on the phone for an hour and however long it was. It just was so smooth. And I just wanted to share that with you. Congratulations, kudos. Christy, our president, she did pop in for a little bit as well. And I know Dr. Wood, our immediate past president, was on as well, but just wanted to thank you for putting together an awesome event. And I'm going to drop off so you can talk.
Thanks so much, Jacqueline.
Thank you, Jacqueline. I appreciate that support and that you were here with us.
Absolutely. Absolutely. All right. Well, everyone have a good evening.
Thank you.
Thank you so much,
Thank
Jacqueline.
you so much.
Would
Lou,
you
in the
all like
chat,
for me
do you
to-
mind stopping the recording, Lou, or please?